Good afternoon and welcome to this session. This is a session to explore family therapy to treat schizophrenia. This is part of AQA Paper 3, part of the Schizophrenia unit. You are required to look at the treatment for schizophrenia, both in terms of the biological treatments and psychological treatments. This is the second of the psychological treatments that we will be focusing on, the first being CBT. There is a previous video on CBT if you would like to go and refresh your mind on that. So, we have learnt from looking at the explanations that the family is very, very important when considering both the prognosis and relapse of schizophrenia. It's now widely recognised that sociocultural factors are very important in the development of schizophrenia. And therefore, today we are going to focus on, essentially, the role of the family and how important the family could be in either helping to prevent relapse in people with schizophrenia. So let's start with a bit of background. We've looked at the use of antipsychotic drugs to treat schizophrenia. Now we need to have a look at psychological explanations. Lots of patients have a problem with using drugs because it's a very passive way without them actually doing anything for themselves. It's been found that about 30% of the population are resistant to drug therapy anyway. And we know that antipsychotic drugs are more effective for the positive symptoms than the negative. So lots of people suffering from schizophrenia also have to rely on psychological therapies to help control and reduce their symptoms. It is suggested that this is not the only therapy though. And that's because most therapies are used in conjunction with a biological therapy. So for example, someone would use antipsychotic drugs in combination with CBT or in combination with family therapy. This is seen to be the most effective treatment, an interactionist approach. The intervention that we're going to focus on today is family intervention. So let's start with some background to the therapy. We know from our lesson on expressed emotion that people with schizophrenia are more likely to relapse if they come from families where they experience high levels of criticism, hostility and over-involvement. These are people who are given mixed messages, people who are not really involved in their care and are practically told what happens. Therefore, family therapy was developed not only to help the patient themselves be treated, but to help the family understand how to reduce those levels of expressed emotion, which we know are so important when dealing with someone with schizophrenia. So, how does family intervention work? Well, firstly, based on previous lessons, we have to understand that the family is not always a safe and friendly environment for everybody. And as this quote here suggests, the family is often disguised as a safe place for people to be cared for. But in reality, they actually might get a lot of their harm from the words and the body language and the expressions from within the family. One of the main problems with an illness like schizophrenia is that the family fail to understand it and fail to understand how to deal with it. Because it's an illness that you can't see, people often feel that there's nothing wrong with the person. And obviously this is a massive problem. So one of the first things would be to ensure that the family were fully educated on exactly what schizophrenia is. So there are several steps to this therapy. These are not exhaustive and you do not have to learn all these in this detail. Just be aware generally of how the therapy works. So, this takes place in people's homes. This is because they are generally more comfortable in their own homes and are more likely to open up. And Usually you will have 2 family therapists who will work with the relatives and patients. It's done anywhere between 3 and 12 months, and they would have regular monthly or more sessions. And it's recommended that a minimum of 10 sessions are used. The next step would be for the family and the patient to start to learn different strategies to help cope better with the mental disorder. And this would be learning about the illness together, but also learning how to create a kind, warm and supportive environment to help the person suffering from schizophrenia make more progress. Help the relatives to be more positive and to talk more positively in their roles. Again, research has suggested that this is very effective in preventing relapse in people who return home after a stay in hospital with schizophrenia. So, moving on to the third step, the relatives are made more aware of the information regarding psychosis. So they will be told in particular what the problems are with that person and what to expect. And I think it's very surprising the number of people who are not fully informed as to what is actually happening and what the symptoms are of that family member. So this is to ensure that people are fully educated with what is meant by psychosis and that the symptoms that they are likely to experience. They would also be helped in techniques as to how to deal with them. The therapist will encourage a group discussion perhaps and encourage people to ask questions about the disorder. And this is so that they can fully understand all the difficulties that the patient faces. In this, they would learn about problems with taking tablets, side effects. They would also learn about the nature of it being an episodic illness, which does not affect them all the time. Something that would be quite difficult for people who do not study this to understand. And the fifth step in this would be to focus on actually looking at the symptoms and getting the patient to explain how they feel. Often people who suffer with mental disorders, particularly a psychotic one like schizophrenia, it's assumed that they cannot talk about their symptoms, and therefore it's often better to allow people to speak, but in a safe, non-judgmental environment. So this is essentially family therapy. It's basically educating people on the illness and making them fully aware of what the illness is. And in turn, this will create a better home environment for people to live in, will prevent less double bind statements and less high expressed emotion. Now we're going to evaluate this. And you do have some evaluation sheets which we will be using. The first thing we're going to talk about is how effective this actually is. Well, if we think about any therapy, we know already from the course that no therapy on its own is totally effective. Usually, a combined approach is the most effective. We're going to focus here on one particular study, and this is the National Collaborating Centre for Mental Health, 2009. As you can see, a meta-analysis was carried out involving 32 studies with a huge sample of participants. And it was a comparison study looking at people suffering from schizophrenia who had family intervention compared to those receiving just drug therapy. The main finding focuses on relapse rate. And as you can see, the relapse rates with people having family intervention therapy are much lower than people in the drug condition. It says there is also a reduction in hospital admissions during treatment and in the severity of treatment symptoms both during and up to the 24 months following intervention. Whilst it's good to learn this study, you certainly need to know what this study suggests. How does this support the therapy? Well, this clearly provides evidence to support it. However, one of the issues would be how scientific is the evidence. It's using a meta-analysis, which is reasonably scientific. We've got a large sample. It's over a period of time. It's a direct comparison, so there are some strengths in this. And it certainly suggests that family therapy is very effective in improving the relapse rates for schizophrenia. It doesn't really tell us much about the rest of how useful it is for schizophrenia, but it certainly tells us about the relapse rates. At this point, you could also assess the usefulness of a meta-analysis, which in this sense would probably be good because you're using a range of research. So, why is it so difficult to assess the effectiveness of family intervention? Because it is difficult. Think about the reasons why and how it's done. And think about the way that you would have to assess it in order to fully understand how effective it was. These are some of the questions that you could put into your essay just to show higher level understanding. So in answer to that question, most patients undergoing family intervention to treat schizophrenia do not usually do it alone. They tend to add in some medication of some form. And this is because the nature of schizophrenia is that it is a psychotic disorder which does require some form of medication. Without it, the patient would continue to hallucinate, continue to have delusions and be very distressed. The drugs would help to relieve that, but the therapy would be the thing that allowed them to move on and prevent relapse, hopefully. So it's very difficult to assess the effectiveness of family therapy because we can't really assess it alone. Because very few people with schizophrenia are only treated with family therapy. Every schizophrenic is usually started on some form of drug treatment. Therefore, we cannot be 100% sure that the decrease in relapse rates are solely down to the effectiveness of the family therapy. Therefore, we can only partially state that it's due to family therapy, but it could also be due to the effects of other factors, such as drug therapy. You can see here how extended we can make this evaluation point. And moving on to the final evaluation point, there are certainly issues of cultural bias with this theory. Consider where the research has taken place. Any research that you've looked at, was it carried out in a Western culture or a non-Western culture? Again, we don't want to be generic, so we need to be quite specific about this. And it turns out that most of the research has actually been conducted in different cultures outside of the UK. A lot of the research that we've looked at today, in particular the study from 2009, was conducted in China. And this is obviously a problem because the systems used to diagnose schizophrenia are different in different cultures. And the 2009 study expressed the view that hospitalisation levels may differ significantly across countries depending on the clinical practice in those countries. We have to take into consideration that schizophrenia is both diagnosed, treated and dealt with completely differently all over the world. And therefore we cannot make sweeping generalisations. So any data that we have on relapse rates from non-UK countries, as we have, are not applicable to a Western culture, and vice versa. There is some research from a Western culture which would be impossible for us to generalise to a non-Western culture. Again, it's another evaluation point that you can apply to this. This ends the session on family interventions for schizophrenia. Please ensure that you have a full set of notes on this. Thank you.